Now perhaps you're dealing with a patient who's recently had a Colles fracture or a Smith fracture, maybe a fracture of their scaphoid. These are common orthopedic fractures which affect the wrist and the distal forearm. There's going to be a period of immobilization, and your patient's going to have a stiffness impairment affecting both wrist flexion and wrist extension. Let's deal with wrist extension first. In order to perform an oscillatory mobilization into wrist extension, we do the prayer exercise, where we do a small amplitude motion in the toe region of the stress strain curve, just barely moving the involved wrist into extension. If the wrist is swollen, we slow the movement down and do a slightly larger amplitude motion to move fluids. And then if we really want to get into the plastic region of the stress strain curve and stretch this wrist in extension, we go farther until the patient gets to an end feel, to where they feel pulling and tugging. Word of caution, do not let your patient experience dorsal-sided wrist pain during this motion. The patient needs to feel pulling and tugging on the palmar aspect of their wrist.